Hello, everyone. Welcome to the Red Hill in Focus webinar series. It is the top of the hour. We've got a lot of information to cover, but I'll give everyone just a minute or so to join and get settled in.
Hello, kada kayo amin. Dahito iti sa webinar kay Red Hill in Focus sa ikang kayo lang tigundaway. Tapno og sagana tayo basit.
Magandang gabi sa inyong lahat. At ito ang webinar series. Mangyaring bigyan kayo ng saglit upang manatili.
Okay. Good afternoon, everyone. My name is Gabriela Carvalho, and I work for the U.S. Environmental Protection Agency in the Red Hill project team. On behalf of EPA and the Hawai'i Department of Health, I want to welcome you to the first event in the Red Hill webinar series. I'd like to pause for our interpreters to instruct those in need of interpretation how to access the interpretation channel.
No kahit yung agding iti Ilocano, translation dahito nga webinar, i-click yung lang data icon, ita baba nga makingkanawan data screen nyo nga na levelan ti interpretation. Tapos pilyon nyo Ilocano.
Kung ibig ninyong mapakinggan ang sa wikang Tagalog na sasalin sa webinar na ito, i-click lamang ang icon sa ibabang kanang panig ng screen ang nakalagay doon interpretation at piliin ang Tagalog na option.
このウェビナーの通訳をお聞きになりたい場合は、画面右下の通訳と書かれたアイコンをクリックし、言語のオプションを選択してください。
Thank you. I understand that the interpreters will now move to those interpretation channels. And let me just pause for a moment for that to happen. Okay, what I would like to propose is that we move forward where our technical team is working on the translation rooms, interpretation rooms. And I'd like to move forward with the presentations. We have excellent information to share with you all today about very important work that's happening. And so while I know I'm asking our technical team to juggle a lot, but would you please go ahead and pull up the slide presentation? If those of you in attendance are in need of interpretation services and you are not getting the information that you need today, if we are not able to resolve this technical issue, please reach out to us at EPA and we will work with you to get you the information that you need. I understand we'll be working in the back end to still try to resolve this issue, and hopefully we'll have an update soon. But I do want to go ahead and get started. As I said, my name is Gabriela Carvalho. I want to welcome you all to the EPA and Department of Health Red Hill in Focus webinar series. Today's event features the Department of Health and the Center for Disease Control Agency for Toxic Substances and Disease Registry. The presenters today will discuss public health activities related to Red Hill. So the Red Hill in Focus webinar series is a webinar series that is focused on the EPA and the Hawai'i Department of Health are hosting to present information to the public on what agencies are doing to address impacts to human health and the environment from Red Hill bulk fuel storage facility releases. Webinar information is available on the EPA webpage on the bottom of your screen. Zoom webinar functions. Hopefully there aren't any other technical issues, but I'm hoping if individuals are having challenges seeing the screen or are having audio issues, hopefully you'll be able to see that there is a button on the bottom left where you can choose your audio settings if that's the issue. Individuals participating can enter questions throughout the presentation through the Q&A box through the icon on the bottom of the screen. So quick agenda. Today, I am giving your introduction. Hello. After my quick introduction, Diana Felton will briefly describe the Hawaii Department of Health Public Health response to Red Hill. Then Stacy Kunkel will provide an overview of the assessment of chemical exposures, ACE1 and ACE2. And then Ben Gerhardtstein will provide some information about public health assessment activities. And then we will have time for questions. I did want to say thank you to those of you when you registered. There were some optional registration questions that were available on the screen, and for those of you that filled them out, we learned a lot, so thank you for that. We learned that 45% of attendees today were personally affected by the November 2021 to March 2022 drinking water contamination at Joint Base Pearl Harbor Hickam. And I just want to pause for a second and just acknowledge that that was a horrendous event. I understand families experienced incredible hardships throughout that event, and we understand people continue to experience those hardships following that event still to this day. So I just want to thank you all for being here today to learn about important work around public health that is currently underway. In the registration form, we also asked what questions you have about public health related to petroleum contamination at Joint Base Pearl Harbor Hickam water systems. And there are so many questions out there. We received questions on a wide range of topics. So I'll just list some of the categories of topics we got questions on. So those were related to ATSDR's work, exposures and health impacts, the nature and extent of contamination in the environment, lots of questions on that, environmental sampling, questions about drinking water testing, data availability, fuel constituents, and the chemicals stored at the Red Hill facility. The medical care services that are available, questions about water filters, very practical questions, questions about accountability, and questions about notification and communication about data availability. So I just want to let you know that those are all excellent questions and they all need to be answered. And our team at EPA and DOH and ATSDR are all working on making sure that those questions are all answered. This particular webinar event today, we are focusing in on ATSDR's work specifically. The intent of the webinar series is to do a deep dive on some very specific topics. So we may not be able to answer all of those questions that were asked, but I just want to let everyone know that we have those. We know that there are questions that need to be answered. If we don't get them today, we are planning future events to help dig into those topics as well. So with that, I'm going to turn it over to Diana Felton at the Department of Health.
Thank you, Gabriella. Welcome to everyone, and thank you all for attending today's inaugural EPA and DOH Red Hill webinar. My name's Diana Felton, and I'm a medical toxicologist working for the Hawai'i Department of Health. My role today is to provide brief background information and describe how ATSDR became involved in the public health response to the Red Hill water contamination. Shortly after the discovery of petroleum drinking water contamination of the Joint Base Pearl Harbor Hickam water system in November of 2021, the Hawai'i Department of Health asked CDC's Agency for Toxic Substance and Disease Registry, or ATSDR, and the National Center for Environmental Health, NCEH, for technical assistance to help us respond to the unfolding public health crisis. This is a really valuable option offered by the CDC for states when an environmental contamination event exceeds a state's health department's capacity. Given the severity and the enormity of the Red Hill water contamination, we knew we needed to bring on additional experts to help us respond and to serve the community affected by this horrible contamination event. ATSDR and NCEH responded very rapidly with a team of experts to assist in 5 specific work areas. The areas of work are listed on the slides here and included a review of the environmental sampling data in the setting of health recommendations, a literature review of all the available science that exists related to the short and long-term health effects of petroleum in drinking water. They provided assistance with water system expertise, including water treatment options and flushing risks, evaluation of the feasibility of blood testing or biomonitoring for JP5 in people's bodies. And additionally, with help with disease surveillance and health impact surveys. This expert assistance was extremely valuable during the initial parts of the response and throughout the last 13 plus months. Their work has helped provide scientifically driven guidance and helped us better understand the health impacts of this contamination, as well as drive ongoing and future response actions to this very challenging and difficult contamination event. The presentations you will hear today will share with you the details of the 2 health impact surveys conducted in 2022 and the upcoming public health assessment activities. Now I'd like to introduce Ben Gerhardstein, environmental scientist from ATSDR Region 9 in San Francisco.
Good evening. I'm Ben Gerhardstein. I'm with ATSDR's Region 9 office, and I'm here with my colleague, Dr. Stacy Conkle from the ATSDR Assessment of Chemical Exposure team. And we will be presenting today, about ATSDR's public health work at the Red Hill Bulk Fuel Storage Facility on Oahu, Hawaii. Like Gabriella, I want to acknowledge at the outset how disruptive and concerning the contamination of the Joint Base Pearl Harbor-Hickam water system has been for many members of the community. And we want you to know that ATSDR is committed to working with partner agencies and engaging community members to investigate health concerns and protect public health. As you probably know, the Red Hill Bulk Fuel Storage Facility is a series of large underground tanks on the island of Oahu that has supported military operations in the Pacific for many decades. It has a total storage of capacity of around 250 million gallons of fuel, and there are miles of pipeline that that move fuel down to the piers at Pearl Harbor. This facility has experienced fuel releases in 2014 and 2021. And in March of 2022, the Secretary of Defense decided to permanently close and defuel the facility. As Dr. Felton mentioned in the introduction, the Hawai'i Department of Health asked ATSDR for support with investigating Red Hill-related impacts after the November 2021 release. And today's webinar, during it, we'll be sharing information about our assessment of chemical exposure, or ACE, health surveys, and our ongoing public health assessment activities. Before that, I'm just going to briefly introduce our agency. ATSDR is a non-regulatory federal public health agency that's based in Atlanta, Georgia. We have various programs that respond to environmental health emergencies, investigate health concerns at contaminated sites, and support our state and local health partners. ATSDR has a congressional mandate to perform public health assessments at contaminated sites, to develop toxicological profiles on harmful substances, to conduct epidemiological studies, and to maintain health registries and to conduct medical surveillance. ATSDR has 10 regional offices across the US that provide a national presence and form working relationships with federal, state, and local agencies and affected community members. And I work in our Region 9 office in San Francisco. In today's webinar, we'll cover ATSDR's 2 work streams related to Red Hill. First, Dr. Stacy Conkle will present on the ACE surveys, which have helped to better understand health symptoms people experienced after the November 2021 Red Hill fuel release. Second, I'll discuss our public health assessment activities to evaluate exposures and health risks related to Red Hill chemical releases since 2005. With that, I'll pass the mic to Dr. Conkle.
Can someone confirm you can see my slides?
Yes, we can.
Great, thank you so much. Thanks, Ben, and good evening. Hello, I'm Dr. Stacy Conkle. I'm an epidemiologist in the Registries and Surveillance section at the Agency for Toxic Substances or Disease Registry at ATSDR. I'm the lead for the assessment of chemical exposures or ACE investigations, and today I will be presenting the methods, purpose, findings, recommendations based on 2 ACE investigations we conducted in 2022 to understand the health effects of the contamination of the Joint Base Pearl Harbor drinking water system. The ATSDR ACE team is led by myself and Maureen Orr, the ATSDR surveillance team lead. For each ACE investigation, Maureen and myself recruit a team of subject matter experts able to rapidly respond to the specific chemical incident at hand. For this incident, starting in on November 20th, 2021, an estimated 9,700 civilian and military households were potentially exposed to a jet fuel known as JP5 in their tap water. Additionally, several schools and workplaces were served by the contaminated water system, and in total, an estimated 93,000 people were potentially exposed to the jet fuel contaminated water. We started our investigation by reviewing what is already known about exposure to jet fuel. Very little is known about the health effects of exposure to jet fuels like JP5. I'm sorry. Very little is known about the health effects of exposure to jet fuels like JP5, the jet fuel of concern in the Red Hill water contamination incident. Even less is known about the potential effects on children. According to ATSDR's toxicological profile for JP5, JP8, and Jet A fuels, most of what is known comes from studies conducted among military personnel exposed to fumes, and among persons who accidentally ingested kerosene, a jet oil similar in composition to JP5. These previous studies suggest that exposure to jet fuel may impact the respiratory system, gastrointestinal tract, and nervous system. Commonly reported symptoms following accidental kerosene exposure include coughing, difficulty breathing, abdominal pain and vomiting, fatigue, and convulsions. Almost nothing is known about the long-term impacts of exposure to jet fuel. Because of the unprecedented nature of this exposure and the potential for health impacts, the Hawaii State Department of Health recognized the need for a baseline assessment of the population affected by the drinking water contamination. And in December 2021, requested investigative assistance from the CDC and ATSDR. The initial ACE investigation was conducted in January and February of 2022. ATSDR provides technical assistance to local authorities in performing epidemiologic assessments after a chemical incident. These assessment of chemical exposures, or ACE investigations, use a toolkit of surveys, consent forms, training materials, and databases that can be customized for use in a rapid response to a chemical incident, like the water contamination event that occurred at the Red Hill Shaft. The objectives of the first investigation were to assess the impact of jet fuel contaminated water on individuals and provide recommendations on next steps, including whether a registry was recommended. The first objective, to assess the impacts of jet fuel contaminated drinking water on individuals, was identified because at the time of the first ACE investigation in January 2022, the health effects of those impacted by the water contamination incident had not been formally recorded, compiled, or assessed. The second objective, to provide recommendations on next steps, including whether a registry was recommended, was identified because the military announced they would be developing a report they called the Red Hill Registry. This report was explained as an incident report that would include a roster of military affiliated persons living in the housing areas served by the contaminated water. The report, at least initially, was not designed to include civilians or workers who may have been exposed. Given ATSDR's expertise in registries, we were requested to provide input on options and needs for establishing a more formal registry. The areas highlighted in orange on this map illustrate the areas served by the contaminated water system. Of note is the Iroquois Point housing community in the bottom left of the map. This community was once military housing and is served by the contaminated Navy water system. The Iroquois Point housing community was once primarily military housing, but is now privately operated and has a large civilian presence. Adults, both military and civilian, were eligible for participation in the first ACE investigation if they lived, worked, or went to school in affected areas between November 20th, 2021, the date of the initial contamination incident, and February 10th, 2022, the end date of the initial ACE investigation survey. Parents were asked to complete the survey on behalf of their children. It's worth noting that our first survey closed before the flushing of the contaminated water system was completed, and the water advisory was still in place for much of the area. The initial survey was designed to be self-administered by participants online. The survey asked individuals about tap water usage, health symptoms experienced, and if medical care was sought. The survey also asked about impacts on children and pets. Outreach and survey recruitment involved engaging community partners via email, setting up tables at water distribution centers, attending community gatherings like farmers markets and blood drives, door-to-door flyering in affected communities, and traditional and social media engagements. 99% of the initial ACE investigation surveys were completed online. A total of 2,289 individuals submitted surveys in the initial ACE investigation. Respondents came from an estimated 14% of households in the affected area, and 88% of participants were affiliated with the military. The initial ACE investigation found that 87% of participants reported at least one new or worsening symptom since the November 20th, 2021 water contamination incident, with 66% of respondents reporting symptoms lasting 30 or more days. As instructed by the Hawai'i Department of Health Water Advisory, 93% of survey participants reported they had switched water sources, and 80% of those who reported they had switched water sources reported they had an improvement in symptoms after switching. The initial ACE survey also found that 37% of participants sought medical care, with 17 people reporting they had been hospitalized for at least one night. This table shows the most commonly reported new or worsening symptoms as of February 2022. Over 60% of participants reported at least one nervous system, dermal tissue, or digestive system symptom. Nearly half of survey participants reported headache, dry or itchy skin, and diarrhea. And over a third of participants reported fatigue, nausea, skin rash, eye irritation, dizziness, skin irritation, and anxiety. Dry or itchy skin, headache, fatigue, and anxiety were the most commonly reported persistent symptoms, lasting 30 or more days since November 20th, 2021. Given these key findings, the initial ACE investigation team recommended that the Hawai'i Department of Health and other community partners, first, ensure the safety of the water system, and rebuild trust in it by clearly explaining what caused this incident, preventing future leaks, implementing a robust water quality monitoring plan, including on-demand water testing, and being transparent and timely with results and updates, including helping community members interpret technical information. Second, we recommended conducting multi-agency hot washes or after-action discussions to capture and apply lessons learned from this response to help improve future response efforts. Delays in detection, response, and communication prompted our recommendations to focus on ways to rapidly detect releases and develop protocols for swift and organized responses, and to plan for rapid and equitable resource allocation. We recommended coordinating communication and actions across agencies. Given the perceived lack of communication between agencies and the reports of confusion from community members, our suggestions to address communication challenges and build trust included using shared communication channels, minimizing conflicting information, and ensuring equity in the response across the affected populations. Fourth, we suggested providing additional education for local health providers to build their knowledge of the events and its potential impacts on health. This education would also be an opportunity to provide guidance for clinical care, including the use of relevant ICD-10 codes, when and how to take an exposure history, and the need for mental health support. Fifth, given the large number of survey respondents reporting new or worsening mental health symptoms, we suggested using ATSDR's Community Stress Resource Center to develop and implement public health strategies to identify and address psychosocial stressors. And lastly, given the high incidence of symptoms and prevalence of persistent symptoms, the limitations of the military health services roster, and the unprecedented nature of this exposure, the team recommended a 6-month follow-up investigation to understand the long-term impacts of this water contamination event. Importantly, at this point, flushing of the water system was almost complete, and many people reported they felt better after switching to an alternate water source. Based on the limited literature of the health effects of exposure to jet fuel, we hypothesized that symptoms from this exposure would have mostly subsided by the 6-month follow-up. At this point, we did not see sufficient evidence to endorse the further development of a formal registry, but caveated this with the assurance that we would reassess this position after the 6-month follow-up ACE investigation. In response to the final recommendation from the initial ACE investigation, the Hawai'i Department of Health formally requested a 6-month follow-up investigation in the summer of 2022. The second investigation was completed in September 2022, approximately 6 months after the flushing was completed, and the final water advisory was amended on March 18th, 2022. Participant eligibility for the second survey was similar to the initial survey, with an extended time frame of eligibility through the end of the final amendment of the Hawai'i Department of Health Drinking Water Advisory. The 6-month follow-up survey was open to the public in September 2022. The follow-up survey built on the initial survey with additional objectives to address mental and physical health, identify pregnancy and birth outcomes, and identify persistent health symptoms among Navy water system users. The follow-up survey also included open-ended text fields for several questions to help us build a more comprehensive understanding of the impacts and experiences of individuals with respect to this water contamination incident. We directly emailed and recruited from those who participated in the initial survey. Additionally, to reach people we may have missed in the first survey and to boost participation, we conducted outreach strategies similar to those in the initial investigation, including canvassing affected neighborhoods and community gathering spots and using traditional and social media. 986 eligible participants submitted survey for the follow-up ACE investigation, which represents an estimated 8% of affected households. This is about half of the number of participants as the first investigation, but still quite a large sample. 61% of participants in the follow-up survey had participated in the initial investigation. And similar to the initial survey, 90% of participants were affiliated with the military. At the time of the follow-up survey in September 2022, the water had been declared safe for about 6 months. Our first survey revealed a lot of mistrust in the water system, and we recommended steps to ensure water safety and to rebuild trust in the water supply. At follow-up, 85% of people were still using an alternate water source or water filters, which is down only slightly from 93% in the first survey when the drinking water advisories were still in place. 46% of participants reported still being very concerned about their tap water at the time of the follow-up survey. And 29% reported smelling or tasting petroleum or seeing a sheen in their water in the past 30 days. When asked, do you think the water is safe now? 76% said they do not think the water is currently safe. Participants said things like, absolutely not, please bring back water distribution. Not particularly for consumption, pets included. And no, I truly believe there are still issues with the water. Many participants reported worse health after the incident. 41% reported worsening of pre-existing conditions, and 31% reported receiving a new diagnosis from a healthcare provider since the incident. Of those reporting a new diagnosis, 25% had no pre-existing conditions prior to the incident. In our initial survey, 86% of participants reported symptoms. In our follow-up survey, 80% of participants still reported symptoms in the last 30 days. 55% of participants reported worse physical health after the incident compared to before, and 21% were kept from usual activities such as self-care, work, school, or recreation for 14 or more of the past 30 days due to poor health. Please note here that our investigations are convenience samples, meaning we try our best to advertise our surveys, but only those who heard about them and were compelled to take them are represented in them. So, our surveys may be biased towards individuals who feel sicker. However, we would like to point out that at the end of the initial investigation, we did not expect to see any persistent symptoms at the 6-month follow-up. The fact that over 700 people that we know of in this community were still experiencing symptoms was concerning. More work is needed to understand if and how the reported symptoms are above the rates we would expect to see in this community. This graph shows the top 10 symptoms reported by the 80% of participants who were still experiencing symptoms in the past 30 days. Headache was the most prevalent symptom and was reported by about half of participants. Anxiety was reported by 40% of respondents. And dry or itchy skin, fatigue, difficulty sleeping, difficulty concentrating, difficulty remembering things, dizziness, diarrhea, and skin rash were all reported by over a third of participants. Among symptomatic participants, 75% reported 3 or more symptoms. Note the trend towards decreasing prevalence in symptoms like nausea and diarrhea, and a persistence in symptoms such as headache and anxiety. 65% of those reporting symptoms expressed high to very high confidence that their symptoms were related to the water contamination incident. An objective of the follow-up survey was to assess mental health symptoms among Navy water system users. 50% of survey participants reported worse mental health after the incident. 57% of participants reported thinking about the incident every day, and 40% of respondents reported having anxiety in the past 30 days. 55% of respondents sought medical care because of the incident. When asked about the highest level of care received, 68% reported seeking care from an outpatient provider, 21% reported visiting an emergency room or urgent care facility, and 12 people reported hospitalization for at least one night. 20 participants reported giving birth since the incident. 8 of these participants reported an adverse outcome. The most commonly reported adverse outcome was preterm birth. Note, however, the numbers of pregnancy and birth outcomes were quite small, so we're limited in drawing conclusions from these data. From the follow-up ACE survey in September 2022, there were 152 pediatric responses provided by an adult. In the initial ACE investigation back in January, 740 pediatric responses were collected. 79% of children in the follow-up ACE survey had 1 or more reported symptoms, compared with 83% in the initial survey. And 65% of children in the follow-up survey had sought medical care, compared with 37% in the initial survey. Note, there were many fewer pediatric responses in the follow-up investigation, and the increase in the proportion of pediatric responses indicating they sought medical care may be attributable to a bias towards the sickest children's parents choosing to participate in our survey. In both the initial and follow-up investigations, we asked about sick pets. In both the initial and follow-up investigations, about half of households reported at least one sick pet since the incident. And at follow-up, 55% of respondents who reported an ill pet had taken their pet to be seen by a veterinarian. The majority of reported pet illnesses involved gastrointestinal issues, skin issues, and lethargy. A few pet deaths were also reported. In the qualitative portion of the follow-up survey, we asked participants, if an event like this occurred in a different community, what would you recommend to residents, first responders, and community leaders there? Respondents advised residents of a community impacted by a similar event to trust their instincts and use their voices to escalate their worries to community leadership, seek documentation and lab testing, and relocate if at all possible. Participants stated that first responders should be prepared for comprehensive environmental testing, and that first responders should be prepared to provide a wide range of resources quickly and consistently across different types of communities. Finally, participants recommended that community leaders be transparent and timely in their response. Community leaders should provide consistent messaging across the various components of the response and listen to the residents of affected communities. To summarize some of our key findings from the follow-up ACE investigation conducted in September 2022, 85% of participants reported still using alternate water sources. 29% reported smelling or tasting petroleum or seeing a sheen in their water in the past 30 days. 80% reported symptoms in the past 30 days, with 65% expressing high to very high confidence that symptoms were related to the incident. 57% of participants reported thinking about the incident every day, and 40% reported anxiety in the past 30 days. 79% of pediatric participants reported being symptomatic in the past 30 days. There are some important limitations to our surveys. Our surveys are convenience samples of participants, so there may be selection bias since more motivated or symptomatic persons might be more likely to participate. Symptom information was self-reported and we did not collect actual exposure data. Additionally, there were some local restrictions on outreach efforts. Survey design limitations include data management complexities, the survey being self-administered, and the survey only being offered in English. This population wasn't easy to reach due to the transient nature of much of this population and a mistrust of government agencies in much of the community. In terms of strengths, we retained many of the questions from the initial survey, which will allow us to look at trends over time. Community partners and community members were highly motivated and engaged, which strengthened the rollout of the survey and increased participation. We received rich and detailed qualitative responses to many questions. We are honored to use our data to generate recommendations for the state and military leadership and appreciate the ongoing efforts to address these recommendations. To start, in order to continue to address ongoing concerns about water safety, we recommended a multi-pronged strategy to rebuild confidence in the drinking water system. We recommended including regular drinking water monitoring at residences and businesses using the Navy water system. We suggested this could include sampling by an independent trusted third party, as well as on-demand testing for residents, even when sampling quotas have been met. Respondents also expressed a strong desire for greater transparency with regards to the testing and monitoring process. We recommended that sampling plans and results be accessible and understandable to the public, and that results be consistently uploaded to a web-based location with plain language interpretations. To restore faith in the agencies involved in past and future responses, we recommended the creation of multi-agency work groups that collaborate in planning and debriefing. We recommended that agencies should establish joint emergency preparedness plans for drinking water contamination and other disaster scenarios. These multi-agency work groups should perform mock drills and plan for coordinated responses, including planning communication strategies that create and deliver consistent messaging across involved agencies. Multi-agency working groups should aim to disseminate critical services and supplies to both military and civilian communities. Additionally, we recommended that planning should include the development of protocols for rapid environmental and biological sampling. We suggested developing and providing guidance and education to the healthcare providers on the clinical assessment and the treatment and management of patients exposed or potentially exposed to petroleum. Additionally, we suggested state and military leadership should support the development of physical health, mental health, and trauma support, and encourage referrals to these services. We suggested that state and military leadership continue to directly support affected communities. We believe it is important for leadership to continue to acknowledge the impact of this incident on and ongoing disruptions to daily life. We see in our data concerns with water quality continuing to impact water use, cause financial strain, and change social patterns. To capture and address ongoing community impacts from this incident, we recommended that community leaders and organizations continue to facilitate support systems and symptom reporting hotlines, accessible to both those living locally and those who have moved away. Finally, it is key to continue to investigate the health and environmental impacts of this unprecedented exposure. We recommended conducting a medical records review for exposed individuals. This should include using and strengthening syndromic surveillance systems with tracking of key symptoms and ICD-10 codes associated with petroleum exposure. We recommended this include a review of birth certificates to better understand peri-pregnancy outcomes, as pregnant people and infants represent vulnerable populations for whom our small sample sizes limited our data interpretation. As part of comprehensive records reconciliation, we recommended linking medical records to exposed individuals' records in DOORS, the Defense Occupational and Environmental Health Readiness System. This is the Defense Health Agency's system to use and track environmental exposures. Following individuals longitudinally will be key in monitoring ongoing and long-term health effects in affected individuals and linking these individuals to needed services. In addition to enrollment in DOORS, we recommended military leadership partner with third parties such as universities to develop and manage a registry of exposed individuals. We suggested this registry look similar to the Flint, Michigan registry. The Flint, Michigan registry was set up to follow community members exposed to lead in their water and help link exposed individuals to needed services. Our final suggestion was for open and transparent sharing of environmental sampling data for ATSDR's public health assessment activities. ATSDR saw a significant number of people reporting symptoms in the 6-month follow-up survey that we did not expect to see. We continue to support this community and are working on several fronts to assist. With regards to our next steps, we look forward to continue to working closely in partnership with the Hawai'i Department of Health. We are continuing to analyze the data collected in our surveys, and we are committed to sharing the findings from our investigations with the public. In the chat, we have provided a link to 2 fact sheets and a peer-reviewed manuscript that have already been developed, and there is much more to come. In response to our recommendations from the follow-up ACE investigation, the Defense Health Agency has formally requested assistance in conducting medical records review for medical records in their system. We have begun planning for this investigation with an expected start date in February. During our investigation, we heard a desire from medical providers for additional guidance on how to handle patients who are still experiencing symptoms. We are working to leverage new and existing resources to help guide providers. Additionally, we have been requested to provide guidance on developing a third-party registry which was another recommendation from our follow-up investigation. We are working with many partners to develop and communicate resources and information on all these requests. We owe a tremendous thanks to our large team at ATSDR and CDC, as well as our amazing colleagues at the Hawai'i Department of Health and our external collaborators who have been true partners in this work. We are all also immensely grateful for the involvement of the Navy, Air Force, U.S. Army Garrison, EPA, community organizations, and of course, our survey participants. This important work could not have been done without them. Thank you.
Hi again, everyone. I'm Ben Gerhardstein again with ATSDR's Region 9 office. I'm going to pick up with a brief overview of ATSDR's second Red Hill project, public health assessment activities. So I'll start by introducing the four people who compose our site team for this work. My colleague in the Region 9 office in San Francisco, Jamie Raymond, is a health educator and community engagement specialist. And our team is joined by two health assessors from our Atlanta headquarters office, Carol Hossam and John Marr. As you just heard, through the ACE health surveys, we have learned a lot about health symptoms that community members reported after the November 2021 fuel release and water system contamination. Survey participants and other community members have also expressed concerns about the possibility of longer-term exposures and health risks and the safety of the current drinking water. So ATSDR's second work stream is going to help to better characterize and understand possible exposures and health risks from the chemical releases that occurred at Red Hill between 2005 and 2022. And that work stream is called our public health assessment process. The Hawai'i Department of Health asked ATSDR to conduct public health assessment activities to help address concerns about chemical releases and health risks that we heard about through these health surveys and other forums. So my presentation is about work that we're in the early stages of right now. And through this work, we're going to be evaluating existing environmental and health data related to releases from the Red Hill facility since 2005. We're gathering the environmental sampling data that's been collected by the Navy and other agencies. We'll evaluate those data along with health outcome information like the recent ACE Health survey results. And we'll use that to determine whether and how exposures could harm people's health. We'll point out data gaps where they exist that limit our ability to draw health conclusions, and we'll make recommendations to protect public health. ATSDR did a public health assessment for the Pearl Harbor Naval Complex Superfund site in 2005, and that assessment touched on Red Hill. So we're focusing this new public health assessment activity on releases from Red Hill from 2005 to present. So I'm going to go through our public health assessment process to help you kind of understand what we do. And I'll start by introducing three big questions we seek to answer. And the questions are, were harmful chemicals released into the environment? Could those chemicals get into people's bodies? And could the amount of chemicals in people's bodies harm their health? These questions help us analyze the exposure pathway and determine possible health risks if the pathway is completed. An exposure pathway is the route or the path a contaminant takes from its source to the point where people are exposed to it. So that's the path from release, which you can see on this slide, the release from a landfill here, through its transport in the environment into the soil, into the groundwater on this slide, to a point of exposure shown here as a drinking water pump, to the exposure route shown here as the person drinking the contaminated water, to the population who was affected by this pathway, and that's the person in this graphic. So if there are any breaks in the pathway, then the exposure pathway is not completed. We work to answer these questions and to trace exposure pathways in communities across the United States that have been affected by chemical leaks, spills, and releases. And here we're focused on chemical releases at the Red Hill facility. In the next few slides, I'll introduce additional questions that come out of these big three, and I'll touch on what we already know about Red Hill releases and what we will continue to investigate. For the first big question, were harmful chemicals released into the environment? We can already say that yes, at Red Hill, we know that jet fuels have been released into the environment several times, including in 2014 and in 2021. We also know that firefighting foam was released in November of 2022. Our public health assessment will seek to identify any and all chemicals that have been leaked from the Red Hill facility into the environment between 2005 and now. And we want to find out as best as we can, where did chemicals leak at Red Hill and where did they move in the environment? How much was released? When were they released? And how long did they leak? With liquids and foams leaking, we're interested in learning more about the soil and groundwater surrounding the Red Hill facility. And we are aware that drinking water in the Navy water system was affected by the November 21 fuel leak for at least several months. So to investigate the first big question, were harmful chemicals released into the environment? And to investigate that through our public health assessment process, the site team starts by identifying what data we need to evaluate exposure, and then we start to gather it. We usually use environmental sampling data that other agencies or organizations collect. We also talk with people in the community to learn about their experience and health concerns, and this helps us understand all the ways people could be exposed to contaminants. We've started this process for Red Hill, and right now we're working to get data and information about the Navy water distribution system and the sampling results that are available, groundwater, chemical gases and soil near the site, releases and leaks from the Red Hill facility, trying to understand the history there, alternative water provided during the incident response we want to know more about, and additional information on health outcomes that people have experienced. Our site team will use existing environmental and health data to evaluate Red Hill related exposure and health risks. We expect that most of these environmental data that we'll use will have been collected by the Navy with the Hawai'i Department of Health and EPA oversight. We'll also be reaching out to other agencies, including the Board of Water Supply, to gather as much relevant data as possible. And we will look at the 2022 health survey data as well to inform our work. The site data and information help us build a picture of which chemicals were in the environment, when, where, and how much. That takes us to the second big question. Could those chemicals get into people's bodies? And the questions that follow from that: who might have been exposed? How much were they exposed to? How long were they exposed? And how often? In the case of Red Hill, we already know that drinking water contamination of the Navy drinking water system was a way that people were exposed. And we will examine the environmental data to see if any other exposure pathways are completed. In our public health assessment process, the second big question leads us to identify ways that people may have been exposed to each chemical and determine if there are any completed pathways. We will consider different possible pathways through the environment a chemical may have taken to get into a person's body. And we will look at environmental sampling data to determine whether the pathway was completed. In the example of jet fuel, we know there was a fuel release and we have data that it was present in the drinking water. For firefighting foam, we know there was a leak, but need to review environmental data to determine if there is a way people could have been exposed in the past or are being exposed now, or could be exposed in the future. We will look at other chemicals that may have been released from Red Hill and track potential exposure pathways. So the third question is, could the amount of chemicals in people's bodies harm their health? This is often the most difficult question to answer. To tackle it, ATSDR health assessors follow our public health assessment process to determine whether exposures in the past, present, or future could harm the health of community members. Using environmental data and knowledge about the community, they will estimate the exposure dose, or the amount of a substance to which a person is exposed over a period of time. They'll compare that estimated exposure dose to known effect levels in the literature to determine the potential for harmful health effects. And they'll also consider effects on people of different ages and stages, and whether there are existing health conditions in the community that could worsen the exposure. Our health assessors will also look to existing research on what is known about health effects of individual chemicals or mixtures, such as jet fuel. And we'll look at the health outcome data for the affected area. By answering these questions about exposure dose and community characteristics, ATSDR will analyze whether exposures in the past, present, or future could harm the health of community members. And this evaluation is when ATSDR tries to answer the difficult question, could the exposure harm public health? When we don't have enough information to know whether exposures could be harmful, we often recommend collecting more data. In the last step, based on the evaluation, we develop conclusions about whether exposures could harm people's health, and we make recommendations to reduce or eliminate exposures. These recommendations can be for regulatory agencies, community members, local groups, physicians, health agencies, and others. And you should know that the public health assessment process can take years from initiation to the release of a final report. This time is needed to build relationships, to connect with community members and organizations, to gather the data and analyze it, interpret it, and write a report and prepare to release it publicly and present it to people. I want to emphasize that throughout this process, we're committed to working with current and former residents and organizations to understand their experiences and exposure concerns. Our team really aims to build relationships and to understand health concerns and to engage partners and resources so that we can do our best work to reduce exposures and improve community health. We do this by participating in community meetings and reaching out and talking to organizational leaders and responding to questions and concerns that folks have. And we'll do our best to keep community members up to date on our progress. So if you want to receive email updates about our public health assessment activities at Red Hill, you can email my colleague, Jamie Raymond, at jrayman@cdc.gov. As I mentioned earlier, we are early in the public health assessment process. We received this request from the Hawai'i Department of Health in July, and since then, we've assembled a team with project management, environmental health science, and community engagement expertise. We've refined the scope of the assessment with the Hawai'i Department of Health's input, and we've begun the process of collecting the available data. So far, we've been communicating with the Navy and the Department of Health about environmental and drinking water data. We appreciate the opportunity to share information with you today, and we look forward to continuing to do so with other groups and organizations. Please contact us if you have questions about ATSDR's Red Hill work, Here are email addresses for questions about the public health assessment process and about the health survey. And with that, I will turn it back to the webinar moderator.
Thank you to Stacy and Ben for your presentations, as well as to Diana. We'll now pull up just a couple of slides for the question and answer session. I want to let you know that there are a lot of questions have been asked in the chat. Thank you so much for entering those. We are going to be focusing today on questions specifically related to the ATSDR study. And just a couple of notes. If you have issues with your water, please report those issues in the state of Hawaii to the Safe Drinking Water Branch at the Department of Health. And if you are in need of medical services, military families can make an appointment at the Red Hill Clinic by calling the phone number on the screen, and civilians can make appointments with your primary care doctor or other medical providers. I will turn it over to our panelists who have been looking through the questions.
All right. Thank you so much for the presentations. Lots and lots of great questions, all very important. As Gabriella mentioned, we'll be focusing on ones that apply directly to the presentations that you've heard. So we can start with a question for Dr. Conkle. You mentioned, someone asked or stated that you mentioned that you had some barriers in outreach, and they were asking if you could provide some examples of those barriers in outreach.
Yes, thank you for that question. So when we were there on island, there were a couple, and probably a number that I'm not remembering currently, but some of the barriers to outreach that I can think of off the top of my head were, we requested access to to come into communities, and sometimes those community boards were really accessible and reachable. Sometimes they were hard to reach, and we didn't get in contact with them in time for them to give us permission to come into those communities and to participate in the community events that were going on in those communities. For instance, farmers markets in those communities, we asked permission. Sometimes we weren't able to get that permission in time. We were only there for a couple of weeks. Other permissions, we requested permission to hang flyers. Sometimes we weren't given permission or were not able to get permission. I think those are really like the major major ones that I can think of. Ben may have some additional thoughts on that, as he was also present in the field.
I would offer that not necessarily a barrier to outreach, but a barrier to participation is that these surveys were rather in depth. They took people some time to fill out, and I think for some people they might have been too long. And so they might have started the survey and didn't finish. And we maybe would have seen a little bit more participation with shorter surveys, but there's a trade-off there with not collecting as much information that's really valuable.
Okay, next question is for Stacy also. Someone asked, how are you making results available to the public?
Great. So yes, we are trying to make our results as accessible to the public as possible. We shared with you in the chat 2 fact sheets that are up and available all the time on the HDOH website. I believe there are links in the chat. We are also publishing peer-reviewed manuscripts. An example of that is also in the chat. That's an MMWR article. And we're doing presentations like this to provide our results to as many community members as possible. In terms of the raw data itself, some of that has sensitive information in it. So I don't believe that there are plans to publish the raw data anywhere.
Okay, next question is for Ben regarding the public health assessment activities. This is about how did you determine 2005 as the starting year for the PHA activities? And to clarify that, are you investigating whether Red Hill was making people sick as early as 2005?
Thanks. So as I mentioned in my presentation, in 2005, ATSDR completed a public health assessment for the Pearl Harbor Naval Complex Superfund site. And that assessment included investigating contamination at some sites near the Red Hill facility. So we're basically starting from that, from the last time that we touched on Red Hill in any of our work and moving forward from there. And so to answer the second part of the question, yes, we're investigating whether people have been exposed to chemicals from the Red Hill facility since 2005 and whether any exposures could present health risks.
Okay, next question for Ben is, will there be data collected or added regarding the cultural implications or impact of having our water poisoned? Native Hawaiians hold water as a sacred resource and a family member.
I want to acknowledge that that's an important question, and it's one that we would really like to learn more about through our community engagement process for this activity and incorporate in our assessment activities. I can't say right now how we would address that issue in a health risk evaluation, but we certainly want to reflect the importance of water and its value and history and cultural significance to Native Hawaiians in our work.
Okay, next question is for Stacy. Has the Navy demonstrated that they have executed or are working on any of the ACE recommendations?
Yes, I believe so. So as I mentioned in my presentation, the Navy has formally requested us to do an ACE investigation with them to do medical records reviews of the medical records in their system, in the military health services system. So we will do that, and we are starting, well, the plan is to start in February to do that. So we're planning for that right now.
Okay, next question is for Ben. What screening level are you using for total petroleum hydrocarbons in your assessment?
So in our public health assessment process, ATSDR uses health-based comparison values as a first screen to identify contaminants that we need to do further public health evaluation on. And we are collecting information about various comparison values that would be appropriate to use for our work right now, but haven't yet determined the comparison value that we'll use for TPH during our public health assessment process.
Okay, next question is for Stacy. Someone asked, do the health surveys done so far explain what will be the health ramifications of the spill years from now?
So yes, this is a question that, everybody would really love to know the answer to. Unfortunately, we do not know the answer. Very little is known about the long-term impacts of exposure to jet fuel, and our ACE investigations really do not shed light on that. We have only collected information up to the 6-month follow-up. But this is why we are very adamant about the recommendation for creating a registry, particularly a third-party registry, so that individuals can feel comfortable in participating in a registry long-term and being linked to any needed services via that registry.
Great. Another question for Ben. Are there any other types of fuels that potentially leaked over the many decades besides JP5? And what are the chemicals of most concern that you're looking at?
If memory serves, and Diana, you can correct me if I'm wrong, it was JP8 that was leaked in 2014, and then JP5 in 2021. So both of those mixtures of petroleum hydrocarbons are of concern, and we'll be looking at. But I do want to note that those are mixtures of many chemicals, and so the way that ATSDR will be investigating is both to look at that as a mixture, but also to be looking for the environmental sampling data for the chemicals that are part of that mixture. And beyond that, we aren't limiting our assessment to the chemicals that are part of those petroleum mixtures. We will be looking at environmental sampling data and using the information that is available there to screen against any chemical that would be harmful to human health.
Okay, next question is for Stacy. And the question is, will there be any further follow-up surveys in the future?
So as I mentioned previously, we are doing an ACE investigation with the Defense Health Agency for those medical records reviews. However, that's not going to include a survey for the community. As of right now, we have not been requested to do any further surveys. However, we would be more than happy to, if invited, do further ACE surveys for the community members in the future. And I would like to add that if a registry is developed, that would be part of what a registry would carry forward, would be some sort of regular surveys for the individuals in that registry to take a pulse on what is happening with individuals in that registry on some sort of regular basis.
Okay, the next question is for both of you, I guess. The question is, will the presenters tonight be present in person next week at the EPA DOD open house 2 days of meetings?
I'll start. Unfortunately, no, we're not going to be able to be present at that event. And speaking for the public health assessment team, we certainly look forward to a future event where we can be present in person. We will have, and Diana, maybe you can speak to that there will be somebody at a table that can provide information about what you've heard tonight, but it won't be myself or Stacy.
Yes, I'll just echo what Ben said. We hope to have a representative there with much of the information that was shared in the chat tonight and printouts, but we will not be able to physically be there in person, but somebody will be.
That is my understanding as well, that there will be a representative with information and fact sheets related, particularly to the health surveys. Okay, we have time for just a couple more questions as we're getting close to the end of the webinar time. So this question is for Stacy, and the question is there information on the effects of in utero exposure to the water contamination?
Yeah, so unfortunately, there is very little research and very little is known about in utero effects of petroleum exposure. I understand that answer is probably not very satisfying. We do hope, and this is part of our recommendations, that we continue to investigate and survey and assess individuals who were exposed, and including women and children in the population who were exposed, to really help add to the literature of what petroleum exposure in utero may be causing. But unfortunately, the answer is there's not a lot of research, and we just don't know.
Thank you. The next question is for Ben. Is a formal epidemiological study a part of the public health assessment activities?
No, a epidemiological study is not part of the public health assessment process. The work that we're doing through the public health assessment process, and also the work that Stacy presented on, the ACE investigations and surveys, are both threads that can lead to recommendations for further health investigation work. And one type of additional step that could be taken would be an epidemiological study. But at this point, that is not in our plans.
I feel like I just keep beating this drum, but one of the reasons for a registry would be potentially doing a more long-term formal epidemiologic investigation.
Great. Thank you, Stacy. And with that is the end of our time for questions to be able to end the webinar close to the closing time. So I will now transfer things to Gabriella for closing remarks. Thank you to the presenters and to all of the attendees for your time and attention and your excellent questions.
Great. Thank you. On the screen now is a list of agency contacts. So for information about EPA and Department of Health work on Red Hill, there are several links where you can sign up for email lists. And there's also a couple of email addresses where you can send information. This presentation, as well as the recording of today's event, will be posted on EPA's website for future access. ATSDR contact information is also provided at the bottom of the screen. These are the email addresses that were shared earlier in the slide presentation. The next webinar event will be announced shortly. If there are specific topics that you would like covered in an upcoming webinar, please email redhill@epa.gov with your suggestions. For all of the webinar series information, you can visit the EPA website at the bottom of the screen. There you will find webinar announcements as well as recordings for past events. With that, I'd like to thank you all for attending today, and I hope you have a wonderful evening.